Under the charismatic leadership of Governor Willie Obiano, the frontiers of excellence have continued to expand in Anambra State. And from sparkling roads and iconic bridges to a watertight security architecture, solid educational fundamentals, a revolutionary community choose your project initiative, and a masterful stimulation of the industrial sector through the Anambra Small Business Agency, ASBA, we have seen the indelible footmarks of visionary leadership. We have also seen ambitious efforts in mechanized agriculture, as well as the emergence of one of the largest poultry farms in Nigeria under his watch. Now, Governor Obiano has turned his vigorous drive for excellence to the healthcare delivery sector, and the narrative can no longer be the same.
Since my administration came to power, maternal mortality rate dropped by 100,000 from 274 to about 93 now, and we want to make it zero. And the infant mortality rate dropped from 197 to 64 now. We want to make it zero.
A close look at the primary healthcare delivery system in Anambra State reveals an impressive effort that is churning out impressive results.
Chief Dr. Obiano is the first government that has a clearly defined blueprint, clearly written out and spelled out, and was given out to the commissioner to implement. And that blueprint is evidence-based and is based on the world's best practice. And is centered on infrastructure, human resources, and then the patient. And that has been fully implemented. It was the blueprint and the implementation that help us to have a clearly defined goal. And we approach this in under three aspects: under the primary, secondary, and tertiary healthcare.
When you look at our primary healthcare under one roof scorecard, as of 2014, October 2014, we were at 7%, mere 7%. But when Governor Willie Obiano came on board, and he bought into the idea that it's good to have these things organized, our scorecard jumped from 7% to 67% in under 1 year.
And apart from that, there were a lot of support around the primary health care. One of the challenges we have in this place is having access to riverine areas. And if you look at the health indices and statistics in this state, you find that most of the worst indices, you get them from those riverine areas. And governor has sat down and said, okay, look into this. What are we talking about? It has improved access to those riverine areas. Provision of both ambulances, speedboats, about 20-something. And then recently, we introduced the KK ambulance model that have not been used anywhere, to make sure that there must be a way of referring patients from primary healthcare to secondary and tertiary, just in a classical knob and spoke pattern, to have a comprehensive healthcare for our people.
We have our vertical programs from the national we carry out twice a year. I'm talking about the Maternal, Newborn and Child Health Week. We also carry out the National Immunization Plus Days. Right now, we just finished the MNA, introduction of the meningitis vaccine into routine immunization. So we have kept abreast with all primary healthcare activities. We coordinate immunization activities, nutrition activities, integrated management of childhood illnesses, and health education. These are core programs under the agency. So the response has been wonderful because each health facility was given basic equipment, including the Keke ambulance. You know, you have some cases that come to the health facility, especially at night. And because they are tricycles, they can move in the communities, even with the rough terrain. For some reason, labor issues usually occur at night. So when you have difficult labor, we move the woman with the Keke ambulance, and any other case that requires a referral. So it has really been very helpful.
It should interest us to see that right from the very beginning, there was a clearly defined approach to the ongoing reforms in the healthcare delivery sector of Anambra State. There was a carefully laid out vision for healthcare delivery in Anambra State.
The World Health Organization recognizes 6 basic building blocks for a functional healthcare system. One, we speak about service delivery. manpower, human resources, data, availability of essential medications, governance and leadership. Then talk about health financing. These 6 different components makes up a functional healthcare system. Goal of this administration is to strengthen the healthcare system by hitting on these individual blocks. Any block you get right ties into the next.
The recent commissioning of the Immaculate Heart Multi-Specialty Hospital Aguleri brings to a head the irrepressible ambition of Governor Obiano for the healthcare delivery sector. The ultra-modern specialty hospital is probably the most high-tech driven medical facility east of the Niger. The hospital seems every bit a showpiece of cutting-edge technology, from dental clinics to general surgeries, and from ultrasound to x-ray services, emergency, anti- and postnatal care, obstetrics and gynecology, as well as pediatrics to laboratory services. The hospital is a grand statement of intent and a worthy addition to Governor Obiano's growing list of brilliant initiatives in the healthcare delivery sector. During the commissioning ceremony of the hospital, Governor Obiano spoke about what the institution means to him and also offered some useful insights into what his administration is doing in other segments of the healthcare delivery sector.
This hospital, that is multi-specialty hospital, will have a helicopter landing pad for medical tourism. That will facilitate bringing patients anywhere in the world to this place for treatment. With this hospital, you shouldn't bother to go abroad for treatment, because all the things that you get abroad, you even get more here.
The location is prime for us. The fact that is a system that we'll be building from scratch. And one key thing we want to do too over there is to make sure that if I cannot afford a neurosurgeon, a world-class neurosurgeon in that place, so have a room dedicated with visuals, where maybe the family physician there sees a patient, is confused about diagnosis. On the click of a button, that neurosurgeon in Houston, Texas, that already has an agreement with the hospital, will come up on board visually and see the patient. He'll be that remote hand that will guide the hands of the family physician that is present to evaluate the patient sitting across the desk, And together they make a judgment and a determination of the next line of action. So you see that patient in Immaculate Heart Multi-Specialty Hospital receiving care 8,000 miles away, and that is what we will envisage for that system. So we want that place to be a system that is living, flexible, able to change with time and move with the trend of care and diagnosis.
The equipment within this hospital very much in tune with what is obtained even abroad. As I said earlier, it's a rural area. So you see interesting cases, especially things that people will not know what they are. May honestly, think is something else. But coming to this place, we're able to discern and inform, educate them so that they now know better. So the hospital has been doing very well so far. So I must commend the state government for having a vision to set up this type of hospital here.
Indeed, the Immaculate Heart Multi-Specialty Hospital is a remarkable legacy that demonstrates in clear terms the desire of the Willie Obiano administration to make quality healthcare delivery easy and accessible to Anambra. This desire can also be seen from the current effort to renovate and refurbish the various medical infrastructure that make up the secondary healthcare sector in the state. The renovation of the General Hospital Onitsha has been going on smoothly, recording vast improvements in the fundamentals of the hospital that were hitherto in absolute distress. A helipad has also been constructed for the landing of helicopters that will serve as air ambulances in terms of emergency. Happily, the general hospitals in Ekwulobia and Enugu are also undergoing similar transformation. They all constitute the core of the secondary healthcare delivery infrastructure that Governor Obiano is rejigging to usher in a whole new era in healthcare delivery in Anambra State.
The first thing was to evaluate and say, okay, let's pick 15 of them for renovation works. And that is ongoing. Assessment has been done, and we are currently hitting them to make sure that we do these structural renovations, equip them, and then get people to work in them. We want to equally elevate 3 of them to multi-specialty level. In one senatorial zone, we speak about Onitsha General Hospital. Then we go to Enugu General Hospital. Work is ongoing there to make it a multi-specialty hospital. You go to Ekwulobia General Hospital. Work is almost like 50% complete over there too. So these 3 general hospitals will tower above the other general hospitals. But the end game is to get all of them to be at that level.
It is also in quest of a new era in healthcare delivery that Governor Obiano recently commissioned the impressive oxygen production plant that was constructed by his administration in the premises of the Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, Awka. The Anambra oxygen production plant is the biggest oxygen plant owned by a state government in Nigeria. The plant is a major legacy project of the Obiano administration. It offers the most purified oxygen to hospitals across the state and serves as a huge critical intervention in healthcare delivery services in the state.
So the icing on the cake is this oxygen plant, which is the biggest by any state government in Nigeria. And the production capacity is enormous. What I directed is that we are going to give 2 cylinders free to all the primary healthcare centers. And that is for government hospitals.
The oxygen we are producing here, World Health Organization puts purity of oxygen 93% plus or minus 3. But the oxygen plants that we have behind produces at 95% purity. We produce 7,500 liters averagely every day. That's a large one. So we are not just thinking only of commercializing the oxygen. Those who need, we will give high quality oxygen, very, very low price as the governor has directed. Then the primary healthcare centers and some other lower facilities, free.
It is a well-known axiom that oxygen is life. However, it is left to the imagination what usually happens when a patient is in their need of oxygen and cannot find it. That underscores the infinite value that this oxygen plant has brought to Anambra State.
God has given us air, but in some situations, in some health conditions, you need medical oxygen. And we are talking of health services. So for completeness, the governor of Anambra State, in his wisdom, said the health sector must be complete. So we are in a teaching hospital here. A time will come when we will pipe the oxygen directly to the world. Okay, that is how it's done over there, and we want to get there. So ensuring quality, affordable healthcare.
But there is also another major component of the superstructure, and that is the Anambra State Health Insurance Agency, ASHIA. In fact, there are clear indications that the Anambra State Health Insurance Agency may be Governor Obiano'S most strategic initiative in the healthcare sector of the state.
Anambra State Health Insurance Scheme was born out of His Excellency Chief Willie Obiano'S vision of giving Anambra State what the healthcare outside this climb look like.
Modeled after similar healthcare insurance schemes in the Western world, as well as the National Health Insurance Scheme, NHIS, the Anambra Health Insurance Scheme seeks to make quality medical care easy and affordable to the people of the state, irrespective of their socioeconomic standing.
There's never a time all of us are going to be sick. If I'm the one who is sick, you take out of the contribution of Okeke and Mbafo and pay for me. When it is Mbafo's turn, you take from all of us and pay for her. That concept of pooling of resources for a risk sharing amongst people is what took the West where they are today.
With the payment of just 1,000 naira a month, the scheme offers top-class medical services to the rich as well as the most economically disadvantaged families.
Somebody who is ill, having needs for antenatal care delivery, whether it's instrumental delivery or surgeries, whether you have appendix and you need appendicectomy, you have hernia, you need herniorrhaphy operation, you need several kinds of surgeries. Somebody is having diabetes, you have hypertension, from diagnosis to treatment, even if the person will be admitted. In our benefit package, we have allocation to admit people for non-surgical cases for up to 15 days in a year, but for surgical cases for up to 21 days in a year. So you can't beat that at paying 1,000 naira every month.
Indeed, there is no doubt that the Anambra State Health Insurance Agency is an idea which time has come. Any doubts about how this institution is fulfilling its mandate are swiftly erased by the deluge of testimonies from the ordinary people. These are mostly civil servants with meager incomes who have found the scheme a veritable tool with which to access the best medical interventions when the chips are down.
I registered as a civil servant under the scheme, and from the onset of the pregnancy, I registered at St. Teresa's Hospital. All the while I've been coming from my antenatal visits, I only pay 10% of my drugs. Then yesterday I delivered of a bouncing baby girl. It wasn't a normal delivery, it was a cesarean section. And I was given a pint of blood. It was all covered without asking for a dime for the blood that was given to me, and I wasn't charged for the delivery.
She told me about this scheme, Asha, so I was just like, are you serious? How real is this? I just don't want to get into something at the end of the day. I get caught up with unforeseen circumstances, but she kept convincing me, telling me that this is not like any other place, that this is Anambra State, that Willie, the governor, is actually serious about it. There's some positive evidence to that effect. So I expected every time she wants to go for an antenatal, I'm supposed to, just like my two sons, every time she wants, I always give her money for antenatal, But coming to this one, I was like, you didn't ask me for money. Say no, it's still that scheme. And I've been going there, I don't pay nothing, just a token of 10% of the drugs. I said, are you serious? She said yes. It's kept going on till yesterday. It's a cesarean section. That's the most she used in putting to bed. I know what it cost, but now that money for that procedure, I have to use it for something else. So I'm so happy. I'm thanking the governor. I mean, whoever that brought up this initiative to him, I'm also thanking the person. I'm thanking Anambra State government because, come on, I'm not from Anambra State, I'm from Imo, and I'm benefiting from Anambra State.
Outside Asia, believe me, I would not be here today. Because at the time we went for scan, they said that she has an umbilical hernia. And the doctor said that the only thing that will end it is a surgical operation. which we planned. I came on a peak date, and today we are here. And just a period of 1 hour, the girl is done, and she's here today. They operated her. They brought her out from the theater around 10. By around 11, everything she's on. Look at her now. You can see her not sleeping and not. So I think by that virtue of this scheme, my dear, I think we have to applaud the government.
I really appreciate the initiator of this program. And I said that God will bless the person that initiated it. Initially, when they started the program, I kicked against it. I said I'm not in support, I'm not interested. But when some of my colleagues, when they came back, they say, hey, you know, I spent just 200 naira. Some say 1,000. I said, wow, let me go and try it. And around February, I came here with two of my children. And they came back. I didn't even spend up to 1,000 plus. I said, wow, what I used to spend 15,000. I said, God. So at least from that time, I started bringing my children and even myself. We start coming to this place. And this one, in fact, I said, God, thank you, because when I came, it was doing too complicated operation. Outside how much you will spend. And I thank God that even when they say the one we are going to pay, my husband said, just thank God, though. This one is even small. You don't have to complain. If outside, you know how much you will spend. I said let them do everything. And I thank God everything went successful. This boy came out.
In all sincerity, the popularity of the Anambra State Health Insurance Agency recommends it to further scholarly inquiries in a country where the smooth delivery of basic health care to a majority of the people have remained a jigsaw puzzle to policymakers. A remarkable aspect of ASHA that stands it out is the scheme's inbuilt adoption model. This has endeared it to philanthropists and public-spirited individuals who wish to make quality Medicare easy and accessible to more beneficiaries in specified communities.
We brought an innovative approach, which we call the adoption model. Get those who are the key stakeholders that have influence, sell the products to them, and encourage them to reach out to their illustrious and philanthropic children who reside whether in Anambra or outside Anambra, to begin to tell them to pay health insurance premium for their people back home. So what we now have is, in the adoption model that we have come up with, you see one philanthropist from a particular community will decide to pay for 100 people, others 50 people, 10, 20, as the case may be. When they have benefited from the health insurance scheme, even when the support line from the adoption model ceases, they would have basis to compare their pre-insurance expenditure on health and insurance period expenditure on health. That way they will be encouraged to pay this premium on their own.
It is interesting to see that the tertiary healthcare sector is also undergoing serious reforms. Chukwuemeka Odumegwu Juku Teaching Hospital has continued to flourish under Obiano. The medical college that was left without accreditation for over 10 years was quickly accredited when Obiano took over as governor. And while he worked on a list of accreditations for other medical institutions in the state, Governor Obiano also facilitated the speedy accreditation of the residency training in obstetrics and gynecology, pediatrics and community medicine in the College of Medicine by the National Postgraduate Medical College of Nigeria and West Africa.
As a matter of fact, His Excellency's attention to healthcare has been of immense benefit to the teaching hospital. As you know, just recently he commissioned the oxygen plant, and that singular move alone has brought down the prices of oxygen here in the teaching hospital. Because before now we normally get oxygen from Enugu, so for now it's within our doorstep, and all thanks to His Excellency. Currently we're housing the only mega lab in the southeast that can handle 510 specimens as against micro labs. As I'm talking to you now, it might interest you to know teaching hospital Unewi, teaching hospital Enugu, all bring their samples here for virology analysis, because we now have a plant that can process 510 specimens, and it is designed that it will be 24-hour power supply services. Now, to be able to do that, there are standby gen. There are 2 inverters, one automatic and one semi-automatic, in addition to our 18 to 20 hours of power supply services, which we currently now enjoy in the hospital. To complement that also is the installation of a 64-slide CT. The surgeons and all doctors know the importance of a CT scan. That again, I can tell you, is very few in Southeast. Complementing this also is the mother-child health care. The only one in Southeast, again, I'll tell you, and that means the maternal-child health care will tremendously improve here. And apart from other developmental stress, our casualty is wonderfully equipped and has all the modern gadgets. And we are still optimistic that more things are coming, because the Excellency recently has approved some buildings for the teaching staff, because as a result of the improved clinical services, more Anambrans are benefiting from the healthcare delivery. And with the introduction of the health insurance scheme, that has also brought a lot of surge in here, and people access Medicare at the cheapest of rates. So all thanks to His Excellency.
Another emerging center of excellence in the growing list of Governor Obiano'S impressive achievements in the healthcare sector of Anambra State is the School of Health Technology, Obosi. Dr. Robinson Mbakogo offers a deep insight into the scope of the transformation recorded by the Institute under Governor Obiano'S watch.
Prior to now, the college has only 3 departments. But on the coming of His Excellency Chief Dr. Willie Madabro Obiano, we introduced 3 new departments, making it 6 departments now, which the college is training. The environmental health technology, the medical laboratory technician, the pharmacy technician, the medical imaging technician, the community health, and the public health nursing. His Excellency benevolently, graciously gave us approval for the first accreditation of the college by the National Board for Technical Education in 2015 by MBTE. And that accreditation, we got it, the National Diploma Accreditation, that made us to admit students through the Joint Admission and Matriculation Board for the first time since the creation of the college. Then currently the college has full accreditation through the gracious approval of His Excellency. In all our departments, we're enjoying full accreditation. We have it for the ND, the pharmacy, the community health, the medical laboratory technician, the environmental health, the medical imaging. Currently, we also have provisional accreditation for HND. So he has done a lot. You have seen for yourself. All the equipment, all the laboratory you have seen is by His grace, His approval. He has interest in this college. Whenever we write, His Excellency is very friendly to our college. We did the first and second convocation of the college under his watch also. So this college is a pet institution for His Excellency.
In all, Governor Obiano'S ongoing reforms in the healthcare delivery sector are a watershed in the quest for new standards in the health sector of the country. The weight of the initiatives he has unleashed and their instantaneous impact on the critical masses of the people give hope that it is possible to give the healthcare delivery system in Nigeria the turnaround we have all been waiting for.
With all our hearts, we pray and ask, God bless Anambra, God bless the shining light that we bear. We're the only ones to make her brighter, the only